Hello, hi. Good morning, good afternoon, good evening, wherever you attendees are. Thank you for taking your time and really coming here and listening to us give you advice. Cumulatively, between Dr. Tixera and I, and now Dr. Sarasoon, we probably have 60 years of experience, 70 years even of experience in graduate medical education, having helped over 2,500 medical students and graduates globally achieve their dream residency and fellowship. We wanted to take this time to take a collective breath. Many of you got into residency. Many of you didn't get into residency, especially if you needed visas. And we're talking not if you're a 2002 graduate and brand new graduates. We have people calling us left and right. And I want this webinar to be of hope, of inspiration, and of strategy. As physicians, we like to strategize and look at data and see how to move ahead. And this is what it's really about. I would like to introduce my distinguished panel. To introduce first Dr. Tixera. He's a chief medical officer and chief academic officer, as myself, at Good Samaritan Hospital in Fresno. He has a background as a physician, and he is involved in academic and clinical leadership. He is a former DIO. And for you folks that don't know who the DIO is a puppet master in the background. Everything has to get approved by the DIO. He runs the whole program. The program directors are under him. So he has tremendous insight. He is a man of kindness. He's a man of integrity and a man that's dedicated his life to academic medicine. So, Dr. Tixera will have you introduce yourself, but let me introduce Dr. Sarasoon. Dr. Sarasoon is very dear to me. First, he's one of the kindest men. And let me tell you, friends out there across the world, good things happen to good people. Dr. Sarasoon has been through this journey with us. He's Canadian. He went through one cycle with us, did not match, but he would always call my PA, the program administrator, and just be positive and say, I believe you guys. I believe you guys. We integrated him into a top program, Montefiore, Albert Einstein School of Medicine affiliated. They had an off-track position and they filled it last year. We were all excited. And they offered him an H1, but that whole H1 mess happened at that time. And it was almost like a shock because he was in, but he never gave up. He said, you know what? I'm still here. I care about this program. I care about you, to the program director. So the program director said, look, although we can't do this H1 now, wait a few more months and we'll rank you very, very high in the program. They knew him. He was the first to come, last to leave. And he is one of the very few, probably handful, that achieved a categorical internal medicine residency with an H-1B visa sponsorship. So miracles do happen. Good things happen to good people. And our panel is testament to that. The more you help others, the more your destiny will be manifested. And just to sum up, I'm Dr. Michael Evers, the founder, chairman, and chief academic officer of Residence Medical Group. We are an education preparation agency. We start residency programs and we help our medical students and our cohorts not only navigate the pathway to medical residency and fellowship, but we prepare them. Our goal is to create the best academic doctors of the future. So without further ado, I'd like to give the platform to the respected Dr. Tixera. Perhaps introduce yourself, and then we can go to reframing what to do now after now that match week is gone. People are celebrating now about where they achieved residency and the ones that haven't. But after this call, we hope you will celebrate hope. We hope that you will celebrate that there is something that can be done. Your story is not over. So, Dr. Tixera, kindly.
Oh, thank you very much for that introduction. So I, in fact, am also Canadian.
Yeah, oh, nice.
So I've transplanted into the United States in 2019. My academic background is from the University of Toronto, where I trained as a physician and an emergency medicine resident, and I practiced academic clinical medicine for 18 years before coming to UCSF, where I was recruited to develop their curriculum. So the way we teach residents, because if you do a little bit of reading around graduate medical education, really a lot of the theory and processes that are involved in graduate medical education come out of Canada. And so I came down here and helped transform the sort of processes at UCSF and UCSF Fresno, where I'm based out of. And then I moved on to a year stint at California Health Sciences University, which is a DO school, where I learned the undergraduate sort of model of how we train medical students in the United States. And most recently, I've been appointed the Chief Medical Officer and Chief Academic Officer for Good Samaritan Hospital, which is actually in Bakersfield, California. We're a brand new residency. We, in fact, have not matched any residents yet, but we will have 4 residents starting July 1st. So there are new programs, 27 in the United States in family practice, that are in the same boat as us. So the match is over for my wife, who's the program director in Fresno, and she'll celebrate at noon today. But just to put things out there and give you the first sign of hope, we are still looking for residents today as we speak. And there are always constant opportunities for you to find, to begin your career in medicine in the United States.
Thank you for that. Thank you for that, Dr. Teixeira. And yes, Canadian medicine is amazing. And really, the doctors that we get from Canada, Dr. Sarasoon and obviously Dr. Teixeira, that joined the American health system, brings such a unique, good bedside manner and the training. A lot of that has been created out there. So it's really an honor. Dr. Sarasoon?
Yes. Before I even start, I just want to give a big shout out and thank you to Dr. Everest for helping me and the whole team for helping me match into internal medicine residency at a wonderful program in New York. So to sum it up, I graduated from a medical school back in India at Sri Ramachandra University. Ever since I graduated, I moved back home, and I was just having this sort of where should I go for continuing my medical journey? And that part, to do medicine in the US was one of my thoughts as well. So, as a visa requiring international medical graduate, the journey wasn't straightforward. I had the strong motivation, the clinical knowledge. I took all the exams, did some clinical experience, applied for the math cycle, but unfortunately, I could not match. And there was always that sort of disappointment during that time that what went wrong and your confidence just shatters. There was no proper guidance. And that's when I heard about Residence Medical through a few of my candidates who were successfully matched with their help. And for someone who's not new to the whole North American medical system, I believe that everyone should have at least someone to guide them, because there's always a chance that you might deviate from normal course, which you think that you're doing everything right, but still you would not end up matching. And that's the whole reason why I chose Residence Medical. And the whole point, what stood out for me was their process was, as soon as I reached out to them when I did not match, I had Dr. Everest reach out the very next day, look through my whole profile, and we went through a whole of my red flags. And he mentioned that, the the ride is not going to be smooth. It's going to be super bumpy. There are going to be a lot of challenges, but we're going to concentrate on things we can change and make you a strong candidate and get you matched. And once I heard that, I know I was actually in good hands, and time is going to be of the essence. And with their help, it's going to be a gradually building process. So I've been with Residence Medical with the whole lovely team. I was able to get good hands-on rotations. So currently, right now, like I'm on a TN visa, which is like a Canadian for visa for Canadians who come to the US to do research and teaching only. And they were able to help me. And the most wonderful thing about Residence Medical is they integrate you into programs where you can spend a lot of time, understand how the hospital runs, as well as build your educational foundations, which is what helped build my medical knowledge, as well as improve communication. And about that, it also helps you understand residents, the culture of the program, uh, which I could not achieve anywhere else, even despite reaching out to a lot of people. And I'm so grateful for all those opportunities. So, looking back, I can confidently say that Residence Medical directed me, structured, and gave me a confidence during a very uncertain time of my life. And to all the IMGs who actually matched this year, congratulations. And for other IMGs, if you had not matched, do not lose hope. You're still an MD. Take time to de-stress, come back strong. And if you ever feel stuck at any point of your life, definitely reach out to Residence Medical. There's always a team right there. They're gonna be there available every time. You have any questions, they're gonna be answering them. They're gonna fix it. And I would say definitely investing in right mentorship and strategy would always be a game changer, especially for international medical graduates with so many obstacles we have to overcome. So, once again, I'm very grateful for the support I received, and uh, what I thought was impossible was totally thrown out of my mind, and Dr. Everest and the whole team made it possible for me.
Thank you, Dr. Sasser. I'm humbled and really bring me tears of joy when I hear your success because you deserve it. And I'm sure Dr. Teixeira, through his career, as you make these doctors, and that's what it's about. Each individual structure and really, really having that whole infrastructure in place as a foreign medical graduate, international medical graduate, especially, it's very difficult, right? You don't have the backing, you don't have the situation room that a U.S. medical school has that helps guide you. You're stuck to getting your advice from chat rooms and trying to figure out yourself. So we give plenty of free advice like this free webinars, and we believe that every doctor should have a chance to fulfill their dream because it is an honorable mission to dedicate your life to serving humanity so that one grandmother, that one mother, father, child can live just a little longer because of all the expertise you have gained through medical science and medicine for treatment. We also believe in academic medicine. We believe that teaching these young doctors the from medical school, we are taught diagnoses and how to treat. But to work within a healthcare system and the nuances of that, you have to have a tinge of academic medicine. That's why I really adore what Dr. Teixeira has done in his curriculum, is really preparing students for the reality of medicine within a healthcare system, which is a whole different game. So you haven't matched. What do you do now? As Dr. Teixeira said, there'll be programs opening up throughout the April, May, June, July. Residence Medical will help our students put folks in probably up and through till September in various specialties. These are high barriers to entry. These folks are hard to get a hold of. Even ChatGPT doesn't have Dr. Teixeira's cell phone number, so you can't call him directly. But yeah, we're happy to help filter you if you want. If you're interested in Dr. Teixeira's program, you can reach out to Professor Heffernan or to us, and we will filter out the ones that fit well in his program. I think he likes Spanish speaking and really helping that society in that wonderful area. What we also believe is, as these rural programs are starting, and you hear about them on Residency Swap or wherever, make sure that you are ready as an international medical graduate to commit staying after. I believe, and I won't put words in your mouth, Dr. Teixeira, but the person that's willing, not just saying it and this is what our candidates must agree to do in a rural or vulnerable population area, staying after medical residency to help build a community, to help build the Good Samaritan medical group. I'm sure they'll hand you a practice after family medicine if you're a good doctor. So you can't just complete your residency and then go off to the big city, because our goal at Residence Medical and our affiliates is to help the doctor shortage in vulnerable population areas. So that's what I would suggest when you reach out to the programs that are just starting. A lot of them are going to be in vulnerable population areas. Don't start thinking too big. I would suggest don't apply to university programs if you're an IMG. At the moment, if you need a visa, the community hospitals are more inclined to help with that. Usually on a first year program, it's just too much to try to start their residency. But the idea is to integrate, and don't be in a rush. Don't say, I want it now. I want it now. That will happen for some of you. I mean, we've helped put people in within a half an hour into a residency. They were qualified. But be ready to show and prove yourself. And that's what residence medical is about. And that's why, and that's what someone, I believe, Dr. Teixeira and Dr. Sarsoon gives a testament is, yes, we want it right away, but put it in. The long game always wins, because that shows commitment, dedication. You can start showing your accuracy in the 6 ACGME core competencies. Those are the important things. But there are many programs that will open. There are many programs that you can apply to. It gets a little tricky with visa. But if you have an older YOG, lower scores, I mean, Dr. Sarsoon has very high scores and it was hard for him. So you just have to be willing to put in the work and get the guidance. Residency is possible. Your dream is possible if you don't give up. Any advice on from here on to July, August, and then moving towards the next year, Dr. Teixeira, and what you see as the writing on the wall in difficulties for you as a leader and decision maker, what you look for in a candidate, sir?
I think that you made an excellent point when you mentioned the ACGME 6 core competencies. So I've just finished reviewing approximately 80 packages. And here's the secret to my approach. And I think all of you are physicians, so we all know this. The SOAPE, SOAPE. So there's the subjective, the objective, the assessment, and the plan. Let's start with the objective. You have your grades, can't alter them. You have your STEP scores, can't alter them. You have your school transcripts and your letters of sort of recommendation, which are things you cannot really alter. So let's put that in that category. Now let's look at the subjective things that you can do as physicians to really highlight yourself as a good or very good candidate for a North American medical school. In medicine, even in the United States, and to a lesser extent Canada, there is very little taught about proficiencies and competencies and entrustable professional activities. And so when you're applying for a job at IBM or General Motors, you want to speak the language of the company or the field you want to practice in. Medicine is no different. We use these things called ACGME competency, CanMEDS proficiencies in Canada, as our DNA for education. And what I'm finding is that very few candidates ever touch upon that subject. And I would say, if you're going to speak the language, show me that you understand the language by talking and in your writings to us. Use the key words that flag us and say, whoa, this candidate knows about advocacy and professionalism. I'm very interested in finding out how they can take their education to the next step and fit in to the way we will evaluate you. So there's a little secret there, because I know we all had an experience when we were children that, really prompted us to be physicians, or we had family members that we want to emulate to be physicians. And those are good stories, but they're everybody's stories that I'm reading about, and they're wonderful. We're in a competitive environment. Let's take the next step and say what I learned through observing my family member as the physician for the village and how they advocated for public health initiatives, for example. And by using that word and literally putting that word in your personal statements is a flag for me that you are ready for that transition to the North American world of education. So there's that subjective things we can modify, how we present ourselves. Um, Look at, and again, Dr. Everest mentioned it, or I think our colleague mentioned it, identify your red flags. Because if you don't identify in the subjective your red flags, it kind of gives schools or programs a sense that maybe you don't really understand how you're going to evolve past that. So there's a second point. Identify within yourself the red flags and then address them overtly and very clearly. And that's the same thing when you're even applying for clinical rotations or observerships. If they're reticent to take you, just say, I have worked on my EMR skills. I'm very proficient in Cerner. That might be that extra sort of trigger that says, okay, let's do this. We've identified some red flags, but you're Cerner competent. You've taken all the HIPAA courses. You've taken, lots of online sort of ethics in medicine courses. You've gone beyond what's required to move on to the next step. So you've got your subjective things you can modify, the objective things you really can't. Then come up with an assessment within yourself. Like Dr. Everest says, are you going to go to UCLA or Harvard? Probably not. I didn't. But that's okay, because 1 in 4 IMGs are the backbone of internal medicine in this country.
Yes.
Right? So your assessment is, I am going to be part of the backbone of internal medicine or primary care in the United States. I have these red flags on my subjective. My objective grades, ranking in my class is this. My assessment is it's going to be competitive and hard, but this is my plan of action. And using, services such as Residence Medical, teams of medical schools have teams of people that give you guidance counselors. If you don't, you're already assessing yourself at a negative opportunity, right?
Right.
So, avoid the internet as much as possible. Go to Reddit to get the, information that you're hearing, but it's chatter. Go to the source.
Great.
And what's the P? P is your plan. Come up with your plan. Is it a 1-year plan? Is it a 3-year plan? Make yourself a plan, right? E, education. Educate yourself on the process. Know the visa rules. I guarantee you, you guys out there in the ether know more about visas than I do, right? I know H-1Bs, I know J visas, right? There are many other types of visas depending on where you come from, what kind of background you have that might be applicable to you. So that's the E, the SOAP-E. Educate yourself to the maximum using the resources you have. So that's my SOAP-E diatribe.
Beautiful. Thank you. I mean, that the wisdom that you folks got out there is it's weight in gold. Thank you, Dr. Teixeira. And Residence Medical, although we help many IMGs, what I've seen, Dr. Teixeira, and I'd like you to dial in on and the tail end of what Dr. Sarsoon of what Dr. Teixeira said, is what we're finding is that there is more help needed for DO graduates these days. A lot of them aren't matching, especially in the tough specialties. We've helped some of these folks get into ortho and psychiatry. So all of the DO graduates out there, as these schools are opening up and you haven't been able to get proper rotations and such, Residence Medical can help you with that. But this webinar is not about Residence Medical. This is about you. You guys can get a hold of us if you want more information. Dr. Sarsoon, as Dr. Teixeira was speaking, tell me a little about the core competencies, the sound judgment, the peer-to-peer communication, all of those ACGME core competencies that you were able to show and to improve as you were spending 40 hours a week, in your research tenure, as you were shadowing the program director, the chairman, the chief resident. How important was that in their assessment? Because you earned it, right? We just opened the door for you. But talk a little about what you learned kindly by you patiently just dialing it in.
Absolutely. So I totally agree with Dr. Teixeira. He put it up perfectly. Like he actually worded it in the form of soap format. It actually, I can totally relate to it. So in like short sentences, if I have to like put it out, they want to make sure if you can actually go maintain a workflow, understand the culture of how the people work there, and make everyone's life easy. So that's what they're also looking for. Additionally, they want to judge how good you communicate with patients. So they expect not just the medical knowledge, they want to know if you could go way beyond, if you could first, for example, if I had to talk to a patient, they first want to know what the baseline is, if the social factors were actually improved, because most problems can be resolved, start right from there. And if you can resolve them, most patients will not even have to come to the hospital. Definitely, there are some chronic problems and which definitely needs hospital level care. So these were some stuff I learned during my time in this hospital. At the same time, I was not exposed to the Epic software, unfortunately, because I have experience in Care One, I had experience in Cerner, I had experience in Meditech. So I this is my first time I even had access to use the Epic. And the good thing is with over time, I was able to understand how to navigate the whole software and how to use the chat box, how to do a chart review of the patient. And it was it was a good learning curve for me, as well as I was able to take participate in didactics, M&M meetings. So there's learning, there's improvement communication skills. I was able to learn from residents like what things they were able to change, and at the same time I also had a good chance to work with research, which was mostly my weak point at one point of time. But I was able to work with on research with residents currently at the hospital, and we're also gonna do a poster presentation, which is coming in 2 days. It's gonna be on a Monday, so I'm excited about that as well. So basic core competencies definitely are more important, like how Dr. Everest mentioned, and it's gradually a learning curve. It's not something you can achieve in a day, and that's what programs uh, look for, other than the stuff you could not change, like your scores, your graduation, the red flags which you cannot change. But there are aspects which you can improve, um, show yourself, take an extra step to ask them, what can I do? Like, what's my role here? What can I do to make your workflow easy? So, this was actually a gradual learning curve. I'm still learning. I'm still trying to understand every everything, and I know I would make it by the time I even start residency.
Well, that's wonderful. That pre-training is so important. And it's really, really important to understand that we live in a microwave society, right? We want to have everything in 30 seconds. But people like Dr. Teixeira and I, we've dedicated our life to academic medicine, to building these systems-based practices. And if someone comes in and says, I want it now, without identifying your red flags or even addressing them, you're just going to set yourself up for failure, because there's nothing worse than being around prepared people, unprepared, because you get the spotlight shines on you right away. And what Dr. Teixeira and what we want to do in the programs we start, we don't want to have to deal with remediation. Well, sometimes things happen, but Dr. Teixeira is going to be seeing these residents probably a lot more than he sees his own family. They'll be there more crack of dawn till sunset. So can you culturally get along with this person? Can you culturally deal with them? That makes a big, big difference. So both for your sanity and the program sanity, right? So, getting all of these factors in an interview, in 20, 30-minute interview, sometimes post soap is difficult. So, you know, the magic has to happen. I'd like to also get some questions answered here. There's a question, as a US MD that matched into a TY but not advanced program. Do you know if any advanced spots are available? Um, there's always advanced spots available as programs open up. It depends on what your CV is geared towards. And I want to address this. There's nothing worse for a doctor, a decision maker in academic medicine, when we hear, I'll take anything. Because if a psychiatrist has dedicated his life to psychiatry and you're a pathologist and you'll take everything, then you don't really love the field. You'll just do it just to do it, just to be a resident. Focus your curriculum vitae on the specialty that you want. A family medicine doctor wants to deal with family medicine dedicated physicians, residents, applicants. A Even internal medicine doctor, although similar, are different. A general surgery program director wants to deal with someone in general surgery. Not let me just get a GS prelim just to get my foot in the door. Because then you'll go in there and you may not get those letter of recommendations. You go into medicine in a specialty where you will make the biggest difference. There's always positions available, advanced positions available. You just have to scour it. You can reach out to us and we can see your particular profile. But we believe in um, a very, very precise laser approach. We don't believe in a shotgun approach. Let me apply for here. Let me apply for this specialty. Hone in your CV on the specialty you're passionate about, and let's make you the best prepared applicant for that specialty. So a decision maker like Dr. Teixeira sees that they have been dedicated to the specialty that I have dedicated my life to, and I can pass the baton on to him. That's what I think is very important, is having some discipline in your CV. Dr. Teixeira?
Agreed. It should be a celebration of a terminus. That's a logical progression, right? So should your personal statement, right? Introduction, body, conclusion. The conclusion should come from the body and the introduction. Many times it's like that scattered approach. Okay, very nice story, but it didn't lead me down to a conclusion that was logical. So yeah, tailor your desires to your career.
Yes, no, very well put. So, as we start wrapping this up, we'll answer some questions. Universal application fixes that you can do is get yourself some real clinical experience. Try to stay away from observerships.
Yes.
There's about seven states that do hands-on, Florida, Ohio. Those are very important. When I suppose when Dr. Teixeira looks at a CV and sees a hands-on rather than a potted plant in the back, it makes a big difference because you've been through that systems-based practices. Get some scholarly activity. It's an important caveat to differentiate your CV. Build yourself on. Now we're building and we're pouncing upon the first AI native doctors that are coming out. No artificial intelligence technology. Don't use it. Don't cheat, but help the program and make your life easier by automating some of your tasks, as Dr. Sarasoon said, with the chatbots on Epic now. So you have to, go with the times and be AI native and build the program into that aspect. Another thing that you can really help is staying planted in a program for at least 3 months. Rotation folks come and go, but you can't really get an assessment in that. Those are some universal fixes, I think. Dr. Teixeira, any universal fixes you and Dr. Sarsoon, if you can add to that too?
I agree with everything you said. Yeah.
Thank you so much, sir.
Be engaged. Be engaged.
Yes, and like Dr. Everest said, that was actually a good point with AI coming into the future, and uh, it's it's the view of medicine is actually changing. We have a lot of resources at our disposal. we have open evidence, we have ChatGPT, and basically we club them with up to date, and knowledge is available right in our hands. And like what Dr. Everest is trying to point out is knowledge is something which we can do, but um, the programs, what they want to know is whether you can actually integrate that knowledge which you actually learn, whether you're able to incorporate it, whether you're actually able to apply those knowledges, which is what expected by most programs where I rotated at. And that's a whole idea why you want to stick with the program, understand the whole system, get to know what are the aspects you can improve on, and whether you could add anything to it. So the longer you, instead of you can get an LOR easily from any observership, but most programs which are looking at is whether actually you did something during that rotation. Like, did you learn something? Like, did you make a change during the rotation? What's something specific you did? So that's a whole idea. If you're able to stick longer in the program, the more you will be able to learn. So that was a wonderful point which Dr. was pointed out.
It's very true. Thank you. Yeah, it was some of the things that, and then we'll take some questions and wrap this up, is you have a letter of recommendation, and I have some of my program director friends say, well, give me a case study on that during that experience. Well, such and such did this, such and such did this, such and such did this. If you have actually been engaged within a hospital system, especially in an academic setting, and you want to go in a hospital system, you will be able to wrote off a case study that you saw that really made an impression on you because you will see a lot of patients. And that makes that experience viable rather than getting an LOR. As Dr. Sarasoon said, you go call a service for $1,200, you do a rotation, get an LOR. But were you able to expand your clinical knowledge, your interpersonal communication skills? So it's all in the nuances. And head honchos like Dr. Teixeira, they see that. They read between the lines. You're not going to fool anybody by just filling up your CV with a bunch of fluff. You have to have depth. You have to have real gravitas in this. And yeah, that's what I believe. Let's answer a couple of questions. How is an old YLG to get into residency? Well, look, an old YLG, it's nuanced. In an old YLG, were you rearing a family? In an old YLG, if you want to go into, let's say, family medicine, and you're from Canada, but you were a family medicine doctor for 10 years with a plethora of cases and a plethora of wisdom, then that YLG can be offset with what Dr. Teixeira said. It has to have a story. But if you were an old YOG, you know, with your feet up on a couch watching, I'll age myself, watching Jerry Springer, then it's not going to be much. But each CV is nuanced, and that's where it takes subject matter expertise to understand. Your thoughts on that, Dr. Teixeira, on an old YOG?
You can see personal growth in a CV and professional growth, right? And that's again, it's a story. A CV is your story of your life. And so, yeah, if you sat on the couch watching Springer, it becomes really easily evident in reading someone's CV, right? Progression, growth, professionally and personally, because what are my training? What are we all training? Lifelong learners.
Yep, it's 100%. The Dr. Sarsoon, some of your older YOG IMG community, and thank you for being our IMG champion. What advice do you give to the older YOGs? Um, please.
Yes, certainly. So, I know there are hard filters for YOG, and people think, okay, I passed a certain number of time. But the most important question they ask during interviews is, what were you doing during that time? Like, was there any, were you doing something meaningful? Like, was it related to medicine? Was there any obstacle? Like, were you training in another country? And I think that's what most programs want to know. They just want you to they want to know if you actually spend quality time during that time where you're improving on yourself. For example, as of me, while I was preparing for my steps, I was working in urgent cares in Canada, right in Toronto. I was able to do observerships in hospital. I was able to uh, also work in refugee camps. So those gave me very good experiences to understand the Canadian healthcare system as well. So they just want to know that were you just not sitting, were you not doing anything, just studying for the exam? Uh, because scores are just going to help you get past that one filter. So once you get past that one filter, they just want to know what kind of person are you? What like what can I know more about you other than the scores? So that's where the whole YOG comes into play. Uh, so just because you have an older year of graduation, do not like lose totally hope. Try to just not sit home, not do anything, do something meaningful, whether it's medicine or whether it's something related to medicine. You can work in a lab, you can work in research. So that was the whole idea of what they wanted to know. And it's not about, you're old, you're a graduate, I'm not going to match. So I think that's the kind of mindset which usually offsets people and kind of brings down their confidence. So uh, it's just a point of how you have to change your views, if I actually
Yeah.
made sense.
No, thank you for that. That's very good advice, straight from the horse's mouth. Even though you're a newer YOG, but I mean, you have friends that. I'll answer a couple more questions, then we're going to close. It goes on about can an IMG get into GS? Yes, an IMG can get into GS. One of our students just achieved categorical residency GS in a university-based program, but he spent over a year and a half there, really proving himself. We sent him on to simulation centers at universities in their simulation labs. Anything is possible. He had high scores, right? And another thing, so yes, it is possible. Sometimes you have to start with a prelim, get your foot in the door, go from PGY 0 to PGY 1. Once you're in the system, you can matriculate if you prove yourself. And another thing that will help you prepare is pass your step 3 if you're an international medical graduate. It'll just make life easier for the leadership. They don't want to give you time off for the step 3. And if you've already done your step, it's almost mandatory, I would think. If you've already done your step, what we like to do with our students that go into the specialties is we ask some of the programs that we've made affiliations with to let them take the first year in training service exam, and we prepare you for internal medicine, the ITE, for family medicine, the FMITE. If you show an ITE score that's higher prior to residency, that eases the burden and the nightmare of a program of will they pass board scores? Will they advance to PG11, PGY2? If you can front load and think in advance creatively, your application will stand out. We just had a person that older Y of graduation, an attempt on their step 2, but their FMITE was the top percentile, somewhere up in the 70s, 78, 80%. The program said, hey, we get it. You can't change your score, but obviously you've improved. We like you. So there's a lot of ways to skin the cat. You just have to get that guidance. You just have to get that that structure. And that's really what residence medical will help you post match is not just getting the residency, right? Because our reputation is on the line, is about preparing you and making sure you're ready for showtime. And that's really the key to all this. We'll be helping people through September for a 26 match. And then there comes a pre-match. But let us get you prepared. Let us get you stylized so you're equivalent as you can be to a Cal North State graduate. So you're equivalent to a Geffen School of Medical graduate from your core competencies. And then you can go out in the field and figure it out. In closing, I'd like to I humbly ask Dr. Teixeira to close. Those are my closing thoughts. And we'd like you in the end, because this is your time to shine, Dr. Sarasoon, let you close, give people hope. Congratulations. Dr. Teixeira and I root for you. You are the future of medicine. And for you, all you folks, DO, USMD, IMGs, non-US IMGs, let me tell you, you have worth. Don't let one match or not match affect what you are about. You went to medical school, you worked hard. Never let that setback become a deterrent to your future. If your destiny is medicine in America and you continue and you continue and you continue, it will be achieved. Just don't do it like a wild person, just running here, running there. Have structure, have performance, have a plan. Someone will see that. The rubber will meet the road and you will get your chance. Just be prepared. I tell people a lot of the time, you got what you prayed for. Now, what are you going to do with it? So get there to the point so when you get your prayers answered, you can actually do something with it rather than fall back. That's my closing thoughts, Dr. Teixeira.
Yeah, I agree. I think it's what you said. You know, the reality is Cal North State is competition. So is UCLA. So is Harvard. So is UCSF in San Francisco. They have resources. Use as many of the resources that you have at hand and recognize that if you need help, there are entities that can help you. Use the language of the GME world. If you don't know it, that's okay. I didn't know it. Read about it, right? If you're reading about, coronary artery disease, the GME world is just as important because you will be living in that world for not just the 3 or 4 or 5 years that you do residency. It involves sort of maintaining CME after you graduate. So embrace it. If you don't know the terminology, it's complex, it's okay. And then wrap your application and wrap your plan around it, and you will succeed. If it's all about advocacy and you've spent your career being an advocate, then that's what should shine when I interview you, when I read about you, and when I read letters of reference. This person is a well-rounded sort of candidate who has a real shine for advocacy. And I think in your program, he will be the chief resident or your next public health officer in Kern County.
Love it. Thank you so much. Great advice. Goosebump given advice. Thank you. Dr. Sarasoon, any closing thoughts for all the folks out there listening?
Yes. So for any medical student out there, any medical graduates applying for residency for the next math cycle, or for any even people who did not match this year, do not think of it as a failure. You're always an MD, as I said. It's just going to be a little pushback where you're going to have to extend your success for a point later, but it's always for the good. Always have a proper mentor, and if you do not, there's always Residence Medical who's going to be helping you in your journey. And when I look back in time, this is one of the best decisions I made. And I can 100% acknowledge that if you really need help, if you really need mentorship, clinical experience, or even any other aspects, definitely reach out to Residence Medical. And good luck with for all the future applicants and for the upcoming math cycle as well. Thank you.
Thank you, my friends. To my Canadian brothers, thank you. You have a wonderful day, everyone. All right. Thank you.
Thank
Thank
you.
you for joining us.